This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. Now we're going to sit down with the newest specialist here, Dr. Jeff Goldman. We're going to talk about colon cancer, how you can prevent it, and the importance of screening. And we're now joined by Dr. Jeff Goldman. Thanks for joining us today. Tell us a little bit about what a gastroenterologist does.
Sure. A gastroenterologist is a medical specialist, and we specialize in caring for patients who have problems with their digestive tract. So this is a diagram of the entire digestive system, and it starts with your esophagus, your food passage. It goes down into the stomach, and then it goes into the 20 plus feet of your small intestine where digestion takes place, and then it enters the colon, which is the lower 5 or 6 feet. The digestive tract also includes the liver, which is a very important organ, and then the gallbladder, which empties into what's called the bile duct, which empties into the small intestine, and the pancreas, which sits behind the stomach, and that also empties its digestive juices into the intestine. And patients come in with a number of very important kinds of symptoms and symptoms that are often quite bothersome to them. They may have difficulty swallowing, they may have pain in their chest or their abdomen, they may see blood in their stool, they may have some change in their bowel habits, either constipation or diarrhea. So there are a number of reasons for which we're consulted.
At what point would a person then seek out your assistance?
Well, if you certainly if you have something that lasts for any period of time or symptoms that are quite severe, so if you had pain that is new and you really don't have a good explanation for it, and it is quite severe, and the pain can be anywhere within your abdominal cavity, if you see blood certainly in the stool, you'd want to seek out consultation immediately, and certainly any kind of pain that's associated with a fever, with nausea or vomiting, inability to eat or stay hydrated. So those are a number of conditions. Pain in the chest sometimes can be the intestinal tract, sometimes could be your heart. So again, you have to seek care to differentiate that.
Are there some common GI issues that can be screened for and actually prevented?
Yes, absolutely. Probably the most important condition of the intestinal tract that can be screened for are they call polyps, and these little bumps or growths in the colon, and they are considered to be the precursor to colon cancer. So they are the forerunner of colon cancer. So perhaps 98% of colon cancer really comes from these polyps, and the idea then is to screen the entire colon, the entire 5 or 6 feet of the lower bowel for polyps and for colon cancer. And actually by finding the polyps, because they grow silently, so you really don't even know they're there, by finding them, removing them at the time of a procedure called colonoscopy, then you actually can prevent the development of colon cancer. So it's really has this unique position, the unique ability to find a cancer before it even starts. And it's the colonoscopy procedure. There's a lot of fear behind it, basically because of the prep, and perhaps only 50% of people who are actually candidates to have the procedure done actually avail themselves and take advantage and actually have the procedure done. So unfortunately, we don't get quite the preventive benefit that's really, there's a high potential to prevent this. So I think it's basically a procedure that's done. It can be done as an outpatient. It takes perhaps a half an hour. So I tell patients, surely your life is worth a half an hour of your time. And you're sedated for it, and you're very comfortable for the procedure, and you don't have to drink some big gallon of yucky type of liquid. There are some suitable preparations. We use combinations of Gatorade or Propel or Powerade Zero, one of the sports drinks, and we have them mix a powdered laxative in it, and it's actually very palatable. I've taken it myself, so I can swear that it's not really all that bad. So it's very doable.
When we're talking about screening and prevention for this, at what age or what are some of the symptoms that we should be looking for when we should start thinking about having this done?
Sure. Well, you can have symptoms certainly, and I alluded to some of the symptoms before. So you can have some alteration or change in your bowel habits. If you're generally regular and all of a sudden it changes, you become more constipated, stools become more loose. If you have some type of unexplained abdominal pain, with that, and certainly if you see any bleeding. So you should never attribute any kind of bleeding from the bowel just to hemorrhoids or what you think might be something else until you've excluded all other causes. So the other important thing is the concept that we call screening. And screening means that you take someone who's at average risk, who has no symptoms whatsoever. In other words, you may have these polyps, and these polyps are commonly found in people over the age of 50, men and women. So we recommend that anyone over the age of 50 who has not had their lower bowel, their colon screened, that they have a colonoscopy. And then if you have polyps, then of course, then you have to follow up periodically, every 3 years, 5 years. If you have a normal screening exam, then it's once every 10 years. If you have some risk in your histories, in other words, if you have a family member, a parent or sibling or something that has been diagnosed with colon cancer at an earlier age, if they were diagnosed in their 40s, you'd want to be screened a decade before in your 30s, or even if they were diagnosed in their 30s, even in your 20s, believe it or not. So it's very important. And then there are also some ethnic groups, African Americans, who need to be screened just on a general basis without symptoms, even in their 40s. So even at an earlier age than the general population.
Okay. Dr. Goldman, we're just scratching the surface of GI issues.
Absolutely.
If a person has any questions, do they need a referral to come see you, or can they just give your office a call?
They can absolutely give our office here at Aurora a call, and they can come in. Most of the patients are seen or referred by their primary doctor, but we do take referrals, self-referrals from patients.
Okay, Dr. Goldman, thanks for taking some time with us today.
Thank you. It's a pleasure to be here.
If you have any questions regarding colon health or any other GI questions, you can contact Dr. Jeff Goldman at the Aurora Medical Center in Oshkosh at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.